Good morning, Dr. Avery.
Good morning.
Tell me about your impression about NYCS prep course.
Well, I think that I learned a lot. I honestly truly learned a lot. And one of the things was my time management. I was able to write my notes in a sufficient amount of time, as well as my encounters with the patients. I would have to say that I had a lot of anxiety when taking this thought. Even the thought of this exam gave me a lot of anxiety. So when I was doing my patient encounters, especially during the mock exams and the SP sessions that I purchased, they helped me with my anxiety by far. And even when I entered my exam, I kept visualizing this as the mock exam, and I was able to go in each one of my rooms of the exam with confidence.
Good.
So I have to say that this course was a blessing, and everything I learned came through on that exam. Everything.
Yeah, and what about the patient notes? Like, did you feel difference of sort of being here?
Yes, because at first, when I first did the patient notes, I wasn't organized at all. My notes were all over the place. I had issues with time management, and when Dr. Somensen, as well as the other teachers, was able to organize my notes, I was able to learn a template, and I was able to master it in the end.
So it's helped you a lot about the organization of the past that you got from the history and the way, the patient notes always start from the way you take the history, So yeah, as you said, they have good experience about patient notes here. And what about the communication skills? Did you get any experience here about that?
Yes, I actually did in terms of communication. Surprisingly, I was weak in CIS, so I had no emotions with any of these patients.
You changed to different personality, but
yes.
in the room,
Yes, because I was nervous and I was very robotic, and with the help of the SPs, they drilled me constantly until I actually showed my emotions. Yes.
So yeah, it's very good. Okay, thank you, Dr. Avery, and nice to meet you.
You too.